May marks National Mental Health Awareness Month, and it's more timely than ever as we are still dealing with the stress of the COVID-19 pandemic. Ashley Sharp tells us the importance of focusing on mental health and what you can do to get help. Good morning, Ashley.
Hey Casey, good morning. In responding to a health crisis like the coronavirus outbreak, some agencies fear another crisis emerging now is being overlooked, this time in mental health. I spoke with local experts about what can be done and why you need to check in with your children. In a time it seems we're focusing so much on physical health, hand washing, masks, social distancing. What if we put that much effort into mental health?
There's all these different changes going on, and a lot of times it makes people feel like maybe their life is not in their control, and a lot of times that can have a negative impact on your mental health.
Emily Wells with the Mental Health Association of East Tennessee says they've seen nearly a 50% increase in people reaching out for help and taking their online screenings.
I don't think that this is a permanent thing. I don't think that you're stuck in this forever, because mental illnesses are treatable and diagnosable.
When you factor in things like the economic downturn, people losing their jobs, and an unknown future, the National Institute of Mental Health says it could potentially lead to an increase in suicide across the country.
Tennessee does have a higher rate of suicide per 100,000 than the nation as a whole, so we have a higher rate than the national average.
The Tennessee Suicide Prevention Network says it's more important now than ever to put a spotlight on mental health for those you love and for yourself.
There is hope, even if you can't see it right now, and that you're not alone in this. There are people out there who can help, and there's help available to you.
And it's not just adults being affected by the outbreak.
Be mindful that this pandemic, as stressful as it was on adults, is also stressful on the children.
Tim Perry with Children's Services at Frontier Health says the pandemic can have a detrimental effect on the mental health of kids.
Routine gives a child a sense of structure, a sense of security. When that is disrupted, it leads to confusion, loss, and even insecurity.
One big loss of structure, not being able to go to school.
Social support is part of the coping process, especially for kids. The support of teachers and coaches and peers gives them that structure of being able to deal with problems and cope with problems.
Dr. Perry says for parents, check in on your kids. It's normal for them to feel anxious and a bit depressed, but if it's lasting for days on end, you need to act now, not later.
Watch them, check in with them, ask them frequently, how are you doing? If there starts to be signs that that child is struggling with that, talk with them about the struggles, be patient, be empathetic, be supportive, but at the same time structured. And if those symptoms continue, do not hesitate to reach out to someone for some professional help and guidance.
Now, as far as how to talk to your kids about mental health and this pandemic, Dr. Perry said that you should use words that they can understand and try to put it in terms that make sense to them so you're getting on their level when talking about this issue. And we'll have more resources listed for you on WJHL.com. Sydney, Casey.